I'm Zoe. I'm representing Advanced Brighter Futures. We're a mental health charity in Wrexham. So TCC member groups have told us that mental health services are overstretched. If elected, what practical steps would you take to improve access to timely, community-based mental health support across North East Wales?
Zoe, and I'm going to start with Corin now from Lavery.
Thank you for the question, great question. Again, it's another one that's really close to me as someone who uses our mental health services. I've personally experienced the issues of the overstretched services, and I've had to advocate for young people in my care when I worked in a specialist step-down service from hospitals, children's home. I personally know improvement is needed, and I'm committed to making sure that people's real experiences are shaping our services of the future. Demand's only likely to increase, and future-proofing the systems so that people get help at the right time is crucial to address issues now and to protect our NHS for the future. We're the first nation in the UK to roll out the 111 Press 2 service for urgent mental health support, and that was under our Welsh Labour government. We've committed to investing $4 billion in new hospitals and modernisation, and that includes the redevelopment of the Wrexham Mile Hospital. We're guaranteeing that anyone with a pressing health need is seen by a member of the primary care team within 48 hours. And we're moving care closer to home with the new community diagnostic services and investing in community-based mental health supports for mums-to-be and new mums, as I was a couple of years ago. We're expanding mental health support so people can get help the same day they need it, providing easy-to-access same-day services so everyone can get the right support when they need it. And we're supporting the NHS to provide more appointments and tests, and obviously the Welsh Government and the MSs that are elected will be working closely with Betsy Cadwallader to Health Board to restore timely access to high quality NHS services, supporting them out of special measures. So yeah, that's me.
Thank you. And Richard Marbrow, Liberal Democrats, please.
You may remember earlier I mentioned the £100 billion before we even buy a box of tea bags. This is where the Liberal Democrats have a unique policy. We recognise that the NHS in Wales is under a massive amount of strain and stress, and mental health services are an integral part of that. And systems that are under a massive amount of strain and stress don't operate well. They start to struggle, it all starts to shake itself to pieces. And we need time, we need to buy time to create the time and the space to fix some of those underlying problems. And so what the Liberal Democrats have said is very clearly, we would put a penny on the basic rate of income tax in Wales in order to pay 5,000 social care placements, which is effectively pulling the cork out of the pressure bottle. On any average day, there's 1,400 patients in Wales that don't need to be in hospital that are. That is creating this massive amount of stress that ripples all the way down through to primary care, mental health services, you name it, it's there. And we are being really honest. We need that £250 million in order to create the 5,000 social care places that takes that pressure out of the system. It is a way of buying time to fix the major problems. Because if you look at Betsy, our troubled queen, clearly this is not working and somebody needs to do something about it, and it has never worked. We need to work out exactly what the answer is and get it right this time. We can't do it by tinkering around the edges. Taking that pressure out of the system with that £250 million is the way to buy the time in order to make those structural fixes that enable the rest of it to work. So we have to take the pressure out of the system, and the Liberal Democrats being really honest about that. Everybody else will talk about efficiency savings. Very posh way of saying, let's sack some more people. What we need is to put actual fresh money into the system, but in the right place, and that's why we said it would go straight to social care in order to take the pressure out of the NHS system.
Thank you, Richard. Next, Carrie Harper.
Yeah, well, we know that a third of GP appointments have a mental health component. I think what that's showing us is that when people are accessing at that stage, they're often very, they're already at crisis points. So that's not sustainable. It's not sustainable for GPs, and it's not sustainable for patients either. But unfortunately, often at the moment, the GP is the only way to access that support. So what we are supportive of is a no wrong door model, and what that is fundamentally about is making sure that when people try to access help, that they're not passed from pillar to post, which is what often happens at the moment. So whether they try and access help via a helpline, online, or via local community groups, that they get early access to that support that they need. We're also very supportive of expanding social prescribing as well. We know that a lot of the underlying issues that drive mental health concerns are about things like isolation, access to housing, they're also about financial pressures, and there are groups in our communities that can help. So a lot of it is about signposting people to the right type of support as well, which we need to be better at doing. So it's focusing on prevention, it's focusing on early intervention, and it's focusing on removing the barriers that are currently there for people to access support.
Do you have the welcome wish indeed? Like Carrie and Lee, shall I?
Thank you. Yeah, so this is a particular topic that I know quite a lot about. I work for a mental health charity that covers Flintshire and Wrexham. It's part of a national franchise, I shall name no names. And we have a contract with BCU for quite a large service, and it's a mess. I want to use the words, but I can't use it because we're in polite company. I deal with a lot of the data and the planning and the administration of that contract. They do not know what they want. They don't know what services they want. They don't know what data they want. And have they spoken to us? No. I know full well that this particular contract, and again I shall name no names, was created by a particular person with an intent for it to be volunteer-based or volunteer-centred. And it has completely morphed beyond all recognition. And this is only one aspect of the complete mess that I see in terms of mental health provision in North Wales, but also in Wales generally. So we need to actually start looking at how we provide mental health services. You know, there are tenders put out to charities, and that's fantastic, but I think there needs to be more governance there. We need to ensure that the quality is there, the service provision is there. Also, people are properly trained, and there's proper systems used as well. I mean, one thing that I find, and I'm going to use this example here for the data reporting back to the health board, we're having to fill in spreadsheets and then manually put them through a Microsoft form. That's ridiculous. It's a multi-million-pound organisation. You should have a portal to do that, or you should have a software system. They need to get themselves sorted.
Thank you. And last but by no means least, on this question, Kristina Renshaw from the Heritage.
Thank you. So having had a personal experience with mental health challenges from a very young age, I understand how complex and deeply personal this can be. What I've seen is that early, consistent support and simply being able to talk to someone who actually listens and understands can make a huge difference. That's why I believe we should strengthen access to community-based support and talking therapies, so people can get help early before things reach crisis point. We also need to make sure that support is consistent and person-centred, so individuals feel properly heard and supported throughout their journey. Because when people can access the right help at the right time and have the right support and opportunities around them, it not only improves lives, but it reduces the number of people reaching crisis point and needing urgent care. But we also have to recognise that services can't carry this alone. We need to look at prevention too, especially for young people, creating opportunities for meaningful work, skills and connection, including in areas like agriculture and rural settings, can give young people purpose, structure and time outdoors, which we all know supports well-being.